Somewhere, right now, a grandmother is covering her mouth when she laughs. A young man is avoiding photos at his own wedding. A child is being teased at school because of a missing front tooth. Losing a tooth is not just about a tooth. It changes the way you speak, the way you eat, the way you see yourself in the mirror. For most of human history, there was no real solution. People simply lived with the loss. Until now. This is the story of dental implants, how a scientist's curious mistake changed millions of lives around the world, and how a tiny piece of titanium became one of the most life-changing inventions in modern medicine. The story begins not in a modern clinic, but in the ruins of ancient civilizations. Archaeologists digging in Honduras in 1931 discovered a 1,350-year-old Mayan skull. A young woman, likely in her 20s. When they looked closer, 3 pieces of carved seashell had been placed into the spaces where her lower teeth had been. And here is what shocked everyone. The bone had actually grown around the shells. The ancient Mayans had accidentally discovered that certain materials can fuse with living bone. They did not know why, they just knew it worked. Across the ancient world, humans tried everything. In Egypt, animal teeth and carved ivory. In medieval Europe, the teeth of executed criminals were transplanted into wealthy patients' mouths. In China, bamboo pegs carved into the shape of teeth. In ancient Rome, iron pins inserted into the jawbone. Some worked for a few years, most failed quickly. None of them truly became part of the body. The dream of a permanent artificial tooth remained just that, a dream, for over 1,000 years. Then came the 20th century, and a Swedish doctor who was studying something completely different. His name was Per-Ingvar Brånemark. He was an orthopedic researcher at the University of Gothenburg in Sweden. In 1952, he was doing an experiment, not about teeth, about blood flow in bone. He placed tiny titanium optical chambers into the leg bones of rabbits to watch how blood moves through living bone under a microscope. When the experiment was over, he tried to remove the titanium chambers. They wouldn't come out. The bone had grown directly into the titanium, locked around it like it was part of the body itself. Brånemark was stunned. He called it osseointegration, from the Latin words for bone and to make whole. And he understood immediately this was not a failure. This was the discovery of a lifetime. For the next 13 years, Brånemark and his team worked quietly, testing, failing, improving, testing again. Then, on September 7, 1965, the first human received a titanium dental implant. His name was Gösta Larsson, a Swedish man in his 30s who had been born with a severe jaw defect that made eating and speaking difficult his entire life. 4 titanium implants were placed in his lower jaw. He received a full set of teeth that were anchored into his bone. Gösta Larsson lived with those original implants for the rest of his life.